Hey, what's up, man?
Not much.
That was a hell of a play.
So why do you think healthcare should not be privatized?
We've done that before. Didn't work out too well.
When did we do that?
It was privatized until Obamacare, and it still is mostly privatized. Obamacare is really just a set of regulations that we have to act within the private community. So we still have private businesses that are controlling our healthcare system. So it's not like it already isn't privatized. And before that, we were privatized.
So why is that bad, I guess?
Well, it's proven that what happened was that the entire point of having. Let me turn down the TV a little bit. I'm sorry. Where's the controller at?
You're fine.
Oh, it's over there. Just watching a football game. The entire point of a corporation is to make profits. Like, that's their only goal, is to make profits for shareholders. So they don't care about actually taking care of people. And when you have a company that's a healthcare company, I think that their number one goal should be taking care of people, not actually making profits.
Right. So I guess on my view on healthcare is that when there's not just one source, it's gonna compete with, next doors. If ABC has, I guess, a price or whatever, then EFG or whatever is gonna have to compete with that. So you're gonna get either, I guess, the service you paid for.
Yeah, the problem is people aren't pepperoni pizzas or or aren't commodities. Like, you have to treat them a little bit differently.
Right.
So the difference is, if you look at what's done today with pharmacies, you'll get like CVS will offer one drug for like $12 a pill.
Right.
And the other pharmacy down the street will offer that same pill normally for $30 a pill.
Mm-hmm.
So what they're doing is they're actually baiting and switching on you to get you to convert all of your pills to CVS, because their advertised price on this one pill is going to save you $28, right?
Mm-hmm.
Or $18. And so, but what they're not telling you is that the rest of your drugs are getting billed at twice what the other company's going to charge. And I actually dealt with a startup that would help you find which prescription was charged at the best price for the pharmacies around you. And you'd be surprised. Like, you could go to one pharmacy for one drug, and then you would go to another pharmacy for another drug, and a third pharmacy for a third drug to fill your prescriptions.
Right.
And then that would allow you to get the best pricing. But Americans are lazy, and is it really worth your time to go save $1 or $2 a pill? It depends how much you're saving, right?
Right.
So at the end of the day, like, even the pharmacist that just came out, it was a pharmacy company that was just overcharging on a pill by, I don't know, 400%. They had raised their price. It wasn't the EpiPen. It was a different one.
Right.
The CEO even came out and said, like, our business isn't taking care of people, it's making profits.
Right.
And he's right. He's absolutely 1,000% right. Like, we shouldn't get mad at him. Like, if you want to live in a free market society, then the owner of EpiPen that bought the prescription for it should be able to do that. But then don't go cry when people talk about socializing our medicine, so that can't happen. You can't have it both ways. So the same people that are out there like saying burn this CEO at the stake for charging 600% extra for that EpiPen because kids are getting sick, and then not being able to treat it and dying, are the same people that are up in arms if you talk about socialized healthcare.
Right.
So you can't have it both ways. Like, you just got to pick one. And generally, what's going to be better for the people is going to be more of a socialized system. I do believe that you have a way to put you have to have a way to allow companies to make money, but you just put caps on it, right? You want to incentivize them, but you also want to make sure that the people are being taken care of. And we still have a lot of people in this country that are uninsured that are paying too much for healthcare that can't afford it, and we're not in a good situation.
Right. So I guess, are you for or against Obamacare?
Um, I like what Obamacare did for a lot of people, like some of the elements of it, but I don't think it's where it needs to be. I'm for a single payer system. I'm for like something like every other developed country in the world has, which is, you're sick, you get taken care of. You don't have to go bankrupt because of medical bills, and the government takes care of it. Right now in America, we pay more per person on a per capita level for health insurance or for health care than any other country in the world where um, where they have privatized or where they have socialized medicine. So why are we paying more when all these companies are profiting off of the sickness and the health of our citizens? Uh, we could actually save money by privatizing or by socializing everything. So I think like I'm definitely for the direction that Obamacare was going, but he couldn't get everything passed in Congress, so he had to take some things out, including the single payer. But taking out the fact that you can get denied for pre-existing conditions, that was huge.
Mm-hmm. No, I'm not like a know-it-all on healthcare. So if I'm wrong, please, let me know.
No, man. I mean, it's a good open conversation. I'm happy to hear your thoughts on it and what you're understanding, and I'm always open to learning as well.
Mm-hmm. I guess I work at a store, and there are maybe 3 or 4 full-timers, and then everyone else is part-time. But we all work, I work easily 30 hours a week minimum. So it's not like I'm only getting like 10 hours a week, like part-time levels. I'm getting like a good amount of hours. But I'm still technically part-time because my company doesn't want to have so many full-timers, so they pay for the insurance.
Mm-hmm. So I mean, the problem is like the company that you're with wouldn't qualify for being forced to have to get insurance for everybody. It's like you have to have at least 30 employees. So the way Obamacare works is like it says small businesses, but
we have more.
Oh, you have more than 30, but you said you only have like 4 and then like a couple part-time. How many
4 full-timers.
How many employees total? 4 full-timers?
Yeah.
And how many total employees?
More than 30. I don't know exactly, but I know more than 30.
And what kind of business is it? You said it's a store, but
a grocery store.
And how many different locations do they have? Is it just
13 to 19, I want to say, in my area.
Yeah.
But it's part of
So
what that
comes down to is just corporate greed. I mean, that's the bottom line. It doesn't cost the company that much more from the bottom line to take care of their employees. Like, I'll give you an example. There's a chain in the Southeast United States called Publix, and that's where I'm at, right? And Publix is mostly owned by the employees. They give a lot of incentives and shares and stockholder shares and options. Everyone has insurance. They're more profitable as far as like a percentage of their gross than Walmart.
Mm-hmm.
Right? And Walmart is doing what you're talking about. They're trying to cut every corner. Their full time is considered 32 hours or 30 hours. They're trying to avoid paying for the healthcare. And then meanwhile, the 3 Waltons that own Walmart, the 3 kids of Sam Walton, have a combined net worth of well over $120 billion, right? If you combine them, they're the richest people in the world. It's like the 3 of them, the sons, so the Walton family. Okay. And all they would have to do is take $500 million of the multiple billions they make every year, and then they could easily cover everyone in Walmart, every single employee. So really, it's just corporate greed. I mean, if the people at the top want to take care of their employees, they can. Like Costco is another good example of a company that takes care of their employees. you start at an average of like $35,000 to $40,000 minimum salary. You have all full benefits, and what that does for a company is it saves them money in the long run. They're going to have happier, healthier employees. They're going to have less turnover. They're going to have less training expenses. They're going to have less theft. All of those things add up to the bottom line that you don't see. It's just invisible. So what a company that's doing what you're doing is just people at the top being greedy. Another example of a company being greedy is Papa John's, right? He was really, really against Obamacare, didn't want to have to pay for it. Meanwhile, the guy lives in a freaking castle, right? And meanwhile, like it's completely up to him to run his business however he wants. I'm not saying he can't, right? This is capitalism. But at the end of the day, let's identify what it is. Don't blame Obamacare. Don't blame the employees. Just blame him because he's the greedy fuck that doesn't want to pay for the health insurance of his employees. And he said that if he didn't want to eat the cost himself, that it would cost everybody ordering a pizza 5 cents. That he would have to raise the pizza, every single pizza he sold, by 5 cents. Now, I don't know about you. I'm happy to pay an extra 5 cents for my pizza to know that my delivery guy and the guy making my pizza has health insurance. Right?
Right.
Would you? I mean, would it hurt you to pay the extra 5 cents to when you order a pepperoni pizza? Instead of $9.95, it's $10 even, or $10.05? No, I mean, obviously not. But no, he's up in arms that this is going to cost him money, and he wants to save every single dime. So now he's cutting people's hours, and he's doing all these things and figuring out ways to game the system, which are hurting his employees, which are going to cost him more employee turnover, instead of just making his employees happy and doing the right thing and taking care of his fucking employees. He's just a greedy scumbag.
Right. I don't know. I feel like, if, I guess by privatized, I mean by like different companies. Like there isn't just like one healthcare thing. Does that make sense?
Well, there's a lot more. Well, we already have that, right? Like, you can have AvMed, you can have a ton of different health options right now. Like, you don't have to have one. Now, right now, what I'm saying is we move towards a single payer, but we can have different companies. But you know what? We all pay as a group, and we pay the same price, and we get taken care of the same. We have preventative medicine, and we go see the doctor whenever we're sick. We go see the doctor whenever we need a checkup. You'd be surprised at how many people don't go to the doctor because they either can't afford it or they don't want to find out something's wrong, and then they wait until it's too late, and it ends up costing them so much more. We're also the nation that leads the world in people that go bankrupt and lose all of their net worth and their wealth. People work their entire lives to save up a little bit of money so they can retire or take care of their kids or pay for a college education. And then they get sick and have to pay hospital bills and end up dying with nothing and leaving their kids nothing and not being able to take care of their kids. We're the only country in the world that does that. It's fucking ridiculous. We're the richest country in the world. Why do we do that? It's because of greed. It's the people at the top that run these companies that want to pad the bottom line and make billions of dollars in profits a year. And you know what? Fuck the rest of us. And that's what privatized healthcare really is. It isn't a free market system that's going to be the best result, and it usually never is, because it doesn't account for human nature, and human nature is greed. If I have the option to do the right thing, I'm going to do the right thing, but not the guy next to me. He's probably not. He's probably going to do the right thing until he doesn't. And next thing you know, he's firing the worker that's been there for 10 years, that's been getting consistent raises, and he's hiring the next kid straight out of college or straight out of high school for half the price. And you saw it. You might be too young to realize, but like there was a chain of electronic stores called
Radio Shack.
No. Radio Shack just went under. There was another one. Oh my God. I'm drawing a blank. Big red building. But anyway, the reason you went there is because the guys knew all the shit, right? You would go there and they would just be able to help you. And this is like before really the internet was even a big thing. It was like in the 90s, like when internet was first coming. So if you need know something electronics, you would go there, and all of their guys knew what they were doing. But a new CEO came in and he said, you know what, we don't need all these experts and people with these things, this knowledge. We could just hire a bunch of kids to do this job. And then the experience of shopping there became so poor that the company was out of business within 5 years.
Right. I don't know. I guess I just don't like the fact that the government would be the goal of that. Does that make sense? Or like the controller of the healthcare.
Yeah, I mean, I can see that. I mean, I don't think that they would be controlling it. They would just be regulating it, right? Like, usually regulation is a negative term, and I can see that. It's a fair point.
What you're
Especially
saying
in America, where everything's.
What you're saying is a good point. Whether or not a company wants to have healthcare or not for its employees is kind of up to the company. I don't think, I guess, that a homeless man should have healthcare if he can't afford it. If that makes sense. I think that Bill Gates, because he has more money, maybe he should have, better insurance and better standard of living, I guess, because, he has more money than, say, I wouldn't. Does that make sense? Because I don't.
So you think Bill Gates's life is more valuable than a homeless man's life?
No, I think that he can afford more. Bill Gates.
But do you think his life is more valuable than your life?
It depends.
I mean, I think every life is pretty precious. I mean, we should take care of everybody, right? How we treat the least amongst us is how we define ourselves as a nation and how we define ourselves and our strengths, right? If you don't take care of the people at the bottom, quickly that trickles up to the middle class and then up even further. It's a really difficult situation. To say that someone shouldn't be taken care of because they can't afford it.
Well, I guess.
Yeah, I don't know.
Like the different standards. I guess if
now not to say in a privatized system, right? In a single payer hit system, there's still going to be the ability to purchase better insurance, right? Bill Gates is still going to have the option to pay for a private doctor that we might not have access to. He's still going to have the ability to get better, quote unquote, better healthcare than us, even in a system like that. It's not going to eliminate that option for him.
Right. Then I guess the bottom line is I don't think the government should regulate healthcare. I think they regulate too much already.
So I mean, I think all the regulation there is a lot of unnecessary regulation, but regulation has come out of necessity, right?
I guess I can see that.
You can go back to like even the robber barons in the early 19th century, and you have, or earliest 20th century, and you have like monopolies that were created, and you had child labor laws that were passed in response to the necessity of stopping kids from being forced to work 20-hour workdays.
Mm-hmm.
You had all right, here, I'll give you an example. What do you think the number one homeless population in our country was 100 years ago?
One more time.
What do you think the number one homeless population in America was 100 years ago?
Like where they were, male, female, race?
Yeah, like race, male, female, whatever, like, and demographic. Number one homeless demographic.
Middle-aged white males.
It was actually the elderly. Now, that was before we had, obviously Social Security, right?
Right.
And Social Security became an insurance program that we created out of the necessity of taking care of our elders. You work and you put in towards it, and then it's there to take care of you when you can't work anymore, because who wants to hire an old man that can't keep up the productivity of a younger kid? And then once you're unable to continue working, you would end up on the streets and dead, unless your family was fortunate enough to be able to take care of you.
Right.
So you had a lot of situations and regulations a lot of things that have grown out of necessity. And if you start peeling those layers back, you're going to end up with situations that are very similar. That's the problem.
Mm-hmm. I can see that, but I don't know. I feel like the government, regulates too much already. And I know I said that, but like I don't need, I guess, the NSA like listening to all my phone calls for whatever reason. I don't think that's, depending on your view, whether that's a necessity or not.
No, I don't believe the government should be listening to anyone's phone calls. I still believe in personal freedom, right? I
Mm-hmm.
still believe in our ability to say and do whatever we want. Like there's a huge thing going on with Colin Kaepernick, and I'm going to post something later about that because I think it's a really interesting situation in that I'm not a big fan of religious or nationalism, like religious dogma or nationalism.
Right.
I believe that both are equally prideful, and I think pride as a capital sin is really shit. Like you shouldn't be too offended if someone tells you that America sucks. You should just be like, yeah, that's your opinion. I mean, America sucks. You shouldn't be like, I'm going to kill you for saying my country sucks. Unfortunately, we have way too much of that in this country. So, I mean, him not standing was actually one of the ultimate expressions of being an American. There are a lot of countries where if he had disrespected their anthem or their flag in that manner, he would have been killed and executed.
Right.
And the fact that he can do that, and even if I may not agree with the reasons he's doing it, the fact that he can do it is an ultimate expression of being an American.
Mm-hmm.
And I fully support anything that everyone should be able to do whatever makes them happy. But like you said, I mean, I don't think the NRA should be listening, or NSA should be listening to our conversations and any of that.
Right. I don't know. I guess if there were like different companies that had like a social security kind of system, like you could choose a company that, I guess has the best prices. That's like in cahoots with, not in cahoots. That's kind of, I guess, partners with different doctors and everybody. And then I guess you kind of pay a little bit into your paycheck, or a little bit from your paycheck to that company, and then have that company kind of dictate where to go, I guess, because then you would have
So I
free.
mean, essentially what you're describing is like the way that it works with companies and privatized healthcare right now, and with Obamacare even. If you want and your company allows, then the company can match or should match or pay for a certain percentage. Come on, Dougie, let's go. They should match, and then your company will tell you, your health insurance company will have the benefits there for you, but you're paying directly out of your paycheck, and then you make sure you're always taken care of that way.
Right. I guess well, I don't know. The bottom line is if companies want to do that, like USAA, or I don't know any other health companies, but excuse me, but if they want to do it, then that's fine. But I don't think the government should do it. I guess is the bottom line.
So I mean, again, it's not the government, right? Like even in a single payer system, you still have private companies that are running it. It's not. You don't go knock on City Hall to go get looked at by a doctor.
Right.
It's still a private company.
Right. I don't know. Austin, do you have any thoughts?
Yeah, I mean, we can ask people to chime in if they have a question.
I'm drawing a blank.
No, I mean, it's okay. I understand, like, a lot of people have this stigma about the government, and rightfully so. I mean, a lot of it has been pretty shit, right?
Right.
But, again, it's out of necessity. And I think that if done correctly, there's still room for. The biggest argument that I've heard against it is that you have no incentive for drug companies to continue doing research and for medical companies to continue doing research. Now, we have drugs that are telling us that they're creating drugs not for people, but to make profits, right?
Right.
So if their incentive isn't to take care of us anyway, then who gives a shit? It's just to keep us sick. It's to treat the symptoms, not to heal us. So maybe it'll be a better thing anyway.
All right. Well, maybe I should do a little bit more research.
Yeah, no worries, man. Yeah, privatization. I think privatization on the healthcare side is actually a good thing for us. I mean, every other country does it. And people like to point at Canada and say bad things about being Canadian, and like it might take you a long time to get a doctor's appointment. Like if you have an emergency, you're taken right in. If you have like a biopsy that needs taken care of, like, or surgery, like a lot of those things are taken care of right away. I know some Canadians, and they've told me, like, coming down here, they're just in awe with how bad our system is comparatively. And the fact that it costs so much money of our money out of our pocket. We already pay so much in taxes here. And our government already pays more per person than all of those other countries toward our healthcare. And yet we have inferior healthcare. And we still have to pay out of pocket ourselves. We still have to, we still have these deductibles. And if not, then it hurts our credit rating. And then our credit rating goes to shit. And then, we have this poverty cycle that starts happening to people because you can't afford to buy things. You end up spending more money on things that you shouldn't. Like it costs you money to be poor. I don't know if you know about the poverty cycle. It's a real thing. Like basically, like if your credit rating isn't very good, let's say you get sick, you go to the doctor, you couldn't afford the doctor, you have bills that go into collections, right? Mm-hmm. Now your credit rating goes down. You run up your credit card trying to pay it off, and now you're having trouble with that, or you lose your job because of being sick. Like all of these things affect your credit rating. Now your credit rating below 600. So in order to get a car or to buy something on credit, they're going to charge you exorbitant credit or exorbitant fees and exorbitant interest rates. And it costs you a lot more to buy the same things that it costs somebody else. People with better credit that make more money are paying less for the same thing. And
right.
A lot of this stems from medical that wouldn't exist. Like, we would be a much better and prosperous country without this situation.
All right. Well, thank you.
All right, man.
There you go.
Hopefully we get to talk about some other subjects that are more fun, man.
All right. I'll weigh your positions.
Yeah, like let me know. And are you a sports fan? Football? What? No sports at all.
No.
I'm looking for people to talk to about the fantasy football and shit, and like I'm trying to get some people to bite. Would love to talk, but let me know on any other position, man. I'm always happy to chime in.
All right. Bye.
Take it easy. Have a good.
You too.
Good night.